Okay. No. No. Good evening, everybody. I'm Dr. Saad Mahdi, consultant anesthesist in Ireland, and I'm very honored to be having this invitation for everybody to join us tonight. I have here Dr. Okay, just 1 second here. What is your CV? Yeah, I have been joined by 4 colleagues tonight with me. We are very esteemed group and very honored to be here. All of us to give you advice how to go shortcut to UK and Ireland and the save your time and the save your effort to be in the right track for your career pathway. If you don't mind, I would be delighted to introduce my best colleagues. Dr. Mohammed Reedy, he is just finished his anesthetic training in UK, and he just due to start a consultant job in University Hospital of Derby and Burton. His interests include obstetric, regional anesthesia, and perioperative medicine. He has completed an obstetric anesthesia fellowship in St. Mary's Hospital in Manchester, as well as advanced training in perioperative medicine and vascular anesthesia. In addition, being a keen educator and has completed a postgraduate medical education certificate from Kiel University, his passion for technology education enabled him to use the technology to develop various educational tools for both medical profession and patients, which is presented nationally and internationally. And the other colleague is Dr. Mahmoud Al-Kulani. Mahmoud Al-Kulani is in the last few months of his training in SAT-7, if you are aware, and we might have a chance to explain that tonight. Dr. Mahmoud Al-Kulani just finishing his training in SAT-7 anesthetic registrar in anesthesia and pain medicine. His main interest, he is in pain medicine, and he gave us a very good lecture before in the MEGA online course about neuropathic pain pathway. The other colleague is Dr. Huda Fauzi. I don't know if she's here. Dr. Huda Fauzi is an anesthetic reg. She works in UK, London, and she is a MD from Alexandria University. And she's a senior person, and she's very well experienced. And she loves to share her experience about her route to UK. Dr. Ahmed Abbas is an anesthetic registrar in Ireland. He's my colleague in Ireland, and he was working as well as a moderator in the MEGA online course. He is a very good, passionate to teaching. He's a good achiever. He went to Ireland by MCI and EDIAC, and he's very good achiever. He got a diploma in Irish diploma in pain medicine. We are going to start, Dr. Reedy. Who is going to start first, Dr. Reedy?
I think my overview lecture, Dr. Saad, is gonna start first, if that's all right.
So Dr. Kulani, I'm honored to introduce Dr. Kulani is going to start first, and we have we collected few questions. We are going to ask them later on if we have time. And Dr. Kulani is yours now. Thank you.
Thank you very much, Dr. Saad. Can you see my shared screen now?
Yes, indeed, yeah. Thank you.
Right, that's brilliant.
You can start your slideshow. Yes, good man.
Yeah. So good afternoon, everyone, and welcome today to our webinar, The Career Pathway to the UK and Ireland. First of all, before starting, I'd like really to express my deepest gratitude to Dr. Mahdi for his endless effort in order to try to help everyone. I think this man is like a lightning gem, and actually he's spreading his light and help to every single person around effortlessly, and you know, sparing no effort actually in order to try to help everyone. So thank you very much to Dr. Mahdi. And I'd like to thank him as well for inviting us today to this webinar. Just to give you an idea, the aim of this webinar actually is for us as a group of physicians who had the chance to work in UK and Ireland, to convey the experience that we might have built throughout our journey in the system to you guys, and bring everything in one place to serve as a potential roadmap for you if you're planning to start a career in UK in anesthetics, pain medicine, or intensive care medicine. Before starting, just quickly, who am I? Like Dr. Mahdi said, I'm ST7 anesthetic trainee within the last stretch of my training with a special interest in pain medicine. I'm also an honorary lecturer in Manchester University. And back home in Egypt, I used to work as a teaching assistant in Ain Shams University. I started here in the UK as an MTI candidate, then as a clinical fellow, and then had the chance to join the training program and go through different stages. So I was privileged to see the system from both sides, as a trainee and as a service doctor and non-training job. Over the coming few minutes, I'm going to carry you in a very quick journey to try to have a flavor or an overview of how the system works in UK. Just to try to tailor your expectations, guys, when you come here to UK, what would you expect? What are the organizations you'll be dealing with? How the system works here in UK, so that we try to help you to hit the ground running actually when you come here. So first of all, conflict of interest, I have none to declare here. This event, this webinar is 100% free. It's 100% voluntary. We're not affiliated to any agencies or any recruitment agencies whatsoever. So it's a personal experience conveyed to you guys sincerely and honestly, and we don't bear any consequences secondary to the use of the advice that you're going to receive today in the lecture. So to start with, when you arrive, guys, here in UK, what sort of organizations are you going to deal with? First of all, definitely what you all hear about. I'm not here patronizing anyone. I'm just assuming that whoever is listening to me doesn't know how the system works in UK. So I'm starting from scratch really. So the first thing is the National Health Service. This is a bigger umbrella that looks after primary, secondary, and tertiary care in UK, social services, etc., etc. When you arrive here in UK, most probably you'll be employed in a junior middle grade position, and you will be employed with one of the NHS trusts as your employer in the system. So that's the first organization you need to know about. The second one is the General Medical Council. So no one working here in UK can touch a patient from clinical point of view without being registered with the General Medical Council with a license to practice. And when you progress through your career and you reach the point of being a consultant, you need to be registered with them on the specialist registry in your area of subspecialty in order to be able to practice as a consultant. My colleagues later are going to expand on this point and elaborate on it, how to get registration with the General Medical Council. But that's a very important organization that you need to know about, because definitely at a certain point you will need to seek their help with registration. The third organization is a technical organization, actually. It's the Royal College of Anaesthetists. That's the organization that supports the training in anesthetics. They set the curriculum in anesthetics. They look after the progress of trainees. If you're pursuing the CSER pathway, which is the equivalence pathway, at a certain point you will need to submit your paperwork to them in order to look into it and see whether you're meeting the criteria or not before passing it to the GMC to make a decision. They look after the FRCA exam as well, which is the Fellowship of the Royal College of Anaesthetists. So at a certain point, you'll find yourself in need to register with this organization if you're going to do the exam, or if you're going to join training, or even later, if you're going through the CSER pathway and you'd like to have a decision from the Royal College and the General Medical Council. For those interested in intensive care medicine, which in UK is a separate subspecialty, can have intake, like we're going to say later, from different subspecialties, but it's a standalone specialty. So there's the Faculty of Intensive Care Medicine, which serves very similar purpose to the Royal College of Anaesthetists. Those like myself with interest in pain medicine, the Faculty of Pain Medicine looks after different stages of training in pain medicine, and they support and police the exam in pain medicine as well, which is a final exam 2 steps exam after you finish your FRCA. Similar thing for the intensive care medicine. It's a final exam called FICM, supported and policed by the Faculty of Intensive Care Medicine. Then those who have an interest in joining training, there is Health Education England, which has subsections in different regions across the country, and you will need to know about them if you're pursuing joining training, and we're going to talk about this in details later. Then comes an organization which actually is not looking after the actual practice of anesthetics, pain medicine, and ICU, but it's a very important organization to know about, which is the British Medical Association. It's like a trade union, if you'd like to call it like that. And the importance of this organization is, if, God forbid, things went south with you, with your hospital, with your supervisor, and everything are running into troubles all over, and you have nowhere to go in order to defend you and have your back during this problem, the British Medical Association is the place. They can look into your contract, see whether it's a fair contract or not, give you legal advice, and so forth. Then comes another organization, which is the Association of Anaesthetists. It's like a club for experts at different stages and levels. They produce guidelines, which are very, very important. We abide by them, really. There are a lot of benefits for joining the Association of Anaesthetists. Used to be called the Association of Anaesthetists of Great Britain and Ireland. Probably at certain stage during your career, you used their guidance while looking after patients on anticoagulation, needing neuroaxial block, while dealing with malignant hyperpyrexia, and so forth. So it's an important organization as well. And last but not least, indemnity agencies. Because if you're going to come here to UK and work, there is a legal requirement for you to be indemnified for the practice you're going to do. So these are a number of organizations. I'm happy to share this presentation with you and provided you with few links for each organization of them. So this is what you expect when you come here to UK. I forgot to say as well that the Royal College of Anaesthetists has a very important section called the International Program, which looks after the Medical Training Initiative, which is a pathway that a lot of people are looking forward to using in order to come here to UK. So that's another importance to the Royal College of Anaesthetists. So you're here in UK, or you're applying for a job, and you'd like to know what sort of jobs or what sort of hospitals you'll be dealing with. And that's a very important point. And in a second, I'm going to say why it's an important point. So there are 2 major types of hospitals here in UK, what we call district general hospitals. These are smallish hospitals. They look after a certain population, and they don't do complex procedures. And then comes the university hospitals, the bigger hospitals, the tertiary centers that look after the more complex procedures. And the importance of that is you have to ask yourself a question. Why am I coming here to UK? Is it to have relatively easy life? To where am I coming from? So a district general hospital might suit me, where I have calm life, good relationships with all my colleagues because we are small in number, we know each other, but I'm not going to do anything complex. Or my ambitions actually and my aspirations are after a major place where I'm going to learn different things and learn major work or subspecialized areas, because services here in UK are centralized for various reasons in big places. And you have to be honest with yourself when answering this question, because what happens? A lot of people might come to a district general hospital, but their aspirations are higher than that, and they start feeling frustrated, asking themselves, are we really in UK? Yes, you are, because this hospital is important in terms of the services it's offering to the population around it. But it's just your poor choice from the beginning, because you didn't ask what sort of work does this hospital do, and you choose the place which doesn't suit you. So you have to ask yourself this question and know what sort of hospital you're walking into. Then we're going to talk a little bit about practice in UK, what you're going to expect when you come here. As a matter of fact, practice here in UK is consultant-based practice. Senior clinician is the consultant who's looking after everything. If you're doing an elective list, there is an assigned consultant for every single room. Even if it's a solo list, there will be a nominated consultant looking after you while you're doing your solo list. And during on-calls, there are actually first and second on-call consultants. They are well paid in order to do their job. Unlike different cultures where your consultant might have his name on your list or your on-call and he will be doing some private work somewhere else, this doesn't happen here because of integrity and property. If he's assigned for an elective list or an on-call, he's more than happy to be phoned. During elective list, he will be attending in person, and he'd rather know about anything and everything, even if it's in the form of, look, I have this patient during on-call, this is my plan, I'm happy to carry on, I'm just letting you know. They will appreciate this. So it's a consultant-based practice, because a lot of people coming to practice here in UK run in troubles simply because they bypass the consultant and they don't let them know what's happening in the background. It's their responsibility, so it's their right to know. The other category of people working here in the system are junior doctors, or what we call middle grade doctors. And those come in two major categories: trainees, like myself, or Dr. Reedy, and he finished his training and becoming a consultant now, or non-training job, which is most probably 99% of you guys will come under this category. Why I'm categorizing this like that, and I think I'm in a good position, Dr. Reedy is the same, in a good position to talk about this, because almost always there will be conflict of interest between yourself and the trainee. The trainee is employed by the deanery, the School of the Specialty, Health Education England. He does have educational objectives, and he or she needs to finish these objectives. So if, let's say, this trainee is coming to this particular hospital to do neuroanesthetics, and you are one of the other non-training categories, staff grade, trust grade, clinical fellow, specialty doctor, and we'll talk a little bit about specialty doctor because it's a bit of different category, but still falls under the umbrella of middle grade. If this trainee has needs, make sure that unfortunately they will be fulfilled and prioritized before your own needs. So what a trainee can do in 3 months, you will have to use longer time if you're proactive in order to achieve it, and that's acceptable. And we've been all through that, so don't be frustrated if this happens. Be open-minded and know well what you signed up for, and what are your rights that you can ask for, and what are others' rights, in order not to have this conflict of interest. Specialty doctor, this is different. Why? Because it's a permanent job. Yes, you're employed by a certain hospital, but you have a national pay scale. You're treated as a senior person. You might have your own lists, especially if it's a smallish hospital. And sometimes in some hospitals, they might look after you as if you're a consultant, but you're not on the specialist registry. So this is why it's a different category of jobs. While the other trusted grade, staff grade, clinical fellow, they are under standalone fixed term contracts with their hospitals. And they are treated as, according to their experience, which will show up after they start practicing and building relations with people. So those are the categories. What else? Nurses. And I'd like actually to ask you to be careful when dealing with this category. Those people are very well trained to do what they are doing, and they are proud of what they are doing. Unfortunately, in some cultures, you undermine the nurses, you bypass them, and you crack on doing things. If you'd like your life to be easy while you're working here in UK, you have to build very good relations with the nurses, value and appreciate what they are doing and what they are being trained to do. They come different categories in our specialty in anesthetics, intensive care, and pain medicine. So as operating department practitioner or ODP, that's a very valuable pair of hands when you're inducing your patient in theater. They know how to prepare the airway equipment. They know how to give you a hand. They understand what sort of problem or complication you're running into, and they can call the appropriate help to come and give you a hand. So value them and respect them. And some of them are senior and very well trained. Airway emergency practitioner, AEP, those people actually can go and respond to cardiac arrest calls as first responders. They are trained to do airway management. They are valuable pair of hands when you go to A&E to respond to a trauma call or an unwell patient that might need intubation. So again, pay them respect. You have a certain category here in UK, like the American system, called anesthetic associates. They are not doctors, but they are well trained to do pre-op assessment, anesthetize patients. They are very good at certain things like doing ultrasound guided regional anesthetics. You won't find them in different places because their number nationally is small, but actually they are very, very valuable and important. Just guys, to let you know, I think I might run over time because we started late. So I'll try to summarize what I'm saying, but stop me please if I'm running over time. The other category you will find in ICU, it's again specific to the UK culture, which are the acute critical care practitioners. They are nurses in background, A lot of them were outreach nurses. They are well trained, and then they are pursuing a certain course in order to be junior doctors in the ICU to fill in the gaps in ICU. They are very well trained. Some of them can do an echo. They know how to prescribe medications, and they have an advantage and privilege over you. Actually, they are thinking as nurses, so they know what pleases nurses on the unit, and they will build the rapport with them quicker than you. So value them and use them actually to help you. And last but not least, specialist nurses. This is inherent to the UK practice. You'll find nurses looking after a specific thing. For me, for example, in pain medicine, I deal with them a lot to do the acute pain ward rounds. They can do detoxification, opioid detoxification clinics. They can do phone clinics, and they are well trained in their position, and you have always to pay them respect and value what they are doing. One other question that you have to ask yourself if you're coming here to UK, what are you seeking? Are you seeking a clinical job or research? We're not like the American system. We're not like the system back home in Egypt, where you can mix clinical and research. Both of them are separate. You can get a research job with a little bit of clinical, but mainly it will be research. So don't sign up for research work and then express your frustration about the system because you're not doing clinical work, because you signed up for research from the beginning. So you have to ask yourself, what are you signing up for? Like I said before, ICM is a standalone subspecialty. It does have a separate exam, separate faculty, dual completion of training certificate at the end. So you can be an anesthetist and ICU person, ANA and ICU person, or acute medicine and ICU person. So if you're pursuing a career as a consultant, either you will have to go through the Caesar pathway, which is the equivalence pathway, and then apply for Caesar and ICM, or you will have to join dual training, including ICM in it, in order to do that. Pain, again, it does have separate faculty, but its training happens within the national training program in UK. As a matter of fact, you can start in anesthetics, pain, or ICM in a non-training position because that's what's available for everyone. And then later you either seek Caesar, which is equivalence, in order to become a consultant, or you seek to join training. And like I said, in ICM, you'll have to apply for a separate ICM number. And then through training, you can become a consultant. What people are expecting you in terms of practice when you come here to UK? Definitely clinical. Our job is clinical. They are expecting skills and knowledge. And to be honest, guys, I'm not worried about the vast majority of you in terms of your skills and knowledge. I'm sure they will be up to scratch and really ticking and very good. Don't worry if you haven't seen a piece of kit or a medication that you haven't used before. People know that it's unfair to ask you to build learning curve in these until you use them. But the bread and butter that keeps you going in our specialty will be good in terms of skills and knowledge. The only thing what we are not good at, especially in a place like Egypt, is documenting what we do. So you have to, and all, if you're seeking career progress, and we're not talking here about someone that's gonna come to UK to have an easy life. No worries with that, no criticism or anything. You have first to ask yourself what you want from coming to UK, because it's not an easy journey. But if you're a proactive person seeking career progress, so you have to document what you do in terms of workplace-based assessments, and they are available on the faculty's websites. Documenting in your lookbook the cases that you do and keeping up to date with these. What's actually very, very important is the second domain, which you will be assessed in, which is attitude. You're coming to a totally different culture, and they are expecting a lot from you. It's not your fault that you came from different culture, but you have quickly to try to understand whom you're dealing with. The English population is very, very polite, not necessarily nice, but they are very, very polite, and they are expecting you to be polite as well, to be honest, to be proactive. So you have to build this reputation and be sure that you're being watched and there's feedback developing about you all the time from the first moment you start in your position. Value the nursing stuff, like I said. If you're working on ICU, you don't expect that the nurse is gonna prepare the line trolley for you to put a central line or a turret line. You have to do this yourself. Know where things are and get rid of your sharps and things after you finish. These simple, tiny things, saying please, thank you, sorry, all these simple things build good reputation for you. build good rapport between you and the nurses, and makes your life easy in the system. The problem has never been about skills or knowledge. Then there are a lot of clinical work. When you write your CV, you have to cover things like clinical governance, like audits, quality improvement projects. You have to be proactive and get involved in these. Teaching, all of us have our teaching commitments. Dr. Reedy finished BG Cert in medical education. I'm gonna finish one very, very soon, plus my position in the university in Manchester due to my involvement with undergraduate students. So you have to keep these ticking as well. Leadership and management. That's very, very important thing in the culture of practice in UK. They'd like to see you as a good team player, but when needed, a good leader, assertive, having a vision, and able to manage on small situations or even the bigger picture. And this can happen through theoretical courses everywhere that you can do, and projects and things that prove you are a good leader and you have skills in management. Publication, I put it before end, because not all people have access to this, and research with 2 exclamation marks beside. If you're proactive in research and you can do research, that's good for you, but not all people have access to that, unfortunately. Within each region, there is a group of people. Please know who they are. Try to make yourself known to them. Try to build relations and social network with them, because they are very important. Be sure that you're gonna need them at certain stage. In each region, there is School of Specialty, School of Anaesthesia, School of Intensive Care Medicine, Regional Advisor for Pain Medicine. Know who are the people there. There is Head of School. There is a Regional Advisor that's a link between the region and the Royal College of Anaesthetists. There is a Director for the training program, we call it TPD. Know this person. And locally in your hospital, it's an educational environment in general, even if it's a small hospital. There will be college tutors as a link between the hospital, the school, and the bigger Royal College. And they are looking after the educational needs of trainees and after the educational needs of proactive non-trainees that are pursuing career progress. Know these people and build good relations with them. College tutors in particular are a good point of contact if you're running in trouble, to go and speak with them. And you will be assigned someone called educational supervisor. He's a consultant that's gonna look after your progress. So you need to keep relation with him all the time. Your progress, if your hospital is proactive enough and looking after people in non-training category, will do you some sort of assessment annually. Most probably it's called appraisal, and that's very, very important, because after 5 years, this is going to be used by the General Medical Council to revalidate you as a person who's fit to practice in the system here in UK. So it's an ongoing work. You don't just arrive to the airport and all your problems are behind you. Actually, your journey starts immediately when you arrive to the airport. Unlike what a lot of people think, it's an easy journey or the end of a lot of the hassle that they might have faced in their lives. Qualifications, test of knowledge, these are very, very important. There are different categories of them, starting from PLAP, which is more suitable for more junior doctors who just finished their internship in their country and would like to come start from junior level in UK, and helps them to do registration with the General Medical Council. While for more senior people, things like FRCA, Fellowship of Royal College of Anaesthetists, 4 parts exam, 2 for the primary and 2 for the final. You have to have the primary exam in order to apply for training if you want, and you can do the primary exam before coming to UK, so you can do it overseas. And when we talk about exams, we're going to talk about this in detail. FECM exam, it's a final exam, so you have to have a primary exam of some sort in medicine, in anesthetics, or in emergency medicine, and then you go through the final exam, the final FECM exam. In pain medicine, there is fellowship of the Faculty of Pain Medicine, and it's again a final exam, so you have to finish the FRCA in order to do that. A lot of people do European exams, like the European Diploma of Intensive Care and the European Diploma of Anaesthesia. These exams can help you to do the CSER, because they are accepted as equivalent test of knowledge. They can help you to apply for GMC registration, but you cannot use them to apply for training, unfortunately. Maybe later, if you're applying for a consultant job and you have one of these under your belt, then you can use it in your CV. But to join training or progress through training, this is no longer the case. It's been in the past, but it's no longer the case for many years now. To your surprise, for the Egyptian guys listening to us, Egyptian exams, yeah, that's right. If you're surprised, the MD degree offered by Ain Shams University is the only exam in Egypt recognized by the Royal College of Anaesthetists as equivalent test of knowledge. What's the use of that? Definitely not GMC registration, unfortunately, but actually you can use it to pursue CSER. So get your GMC registration by one mean or another, and then present evidence of the equivalence pathway. And if you have the MD from Ain Shams University under your belt, you can argue actually that you have the test of knowledge required and you can apply for the CSER pathway without needing to do any of the other exams. The important question that everyone asks, how can I get a job? As simple as this, you need GMC registration. And like I said, our colleagues are gonna elaborate on this further. You need to use some portal to search for jobs. One of the most famous is the NHS jobs. Go and set up an account, sign up for an account and search for jobs. Some people use agency. I put a question mark and 2 exclamation marks. I don't think there is need. Like I said, we are not affiliated to agencies, but if you feel comfortable to use them, do, no worries, but you don't necessarily need them really. I'm approaching the end of my lecture now. So tips to successful journey here in UK. How can you achieve success? Like I said, attitude. It's a different culture. Pay courtesy to others. Say thank you, say sorry, say please. Don't cook things up, don't be pedantic. Be simple. If you don't know something, just say, I don't know. Ask for help. When you come here, you will be surprised that consultants who come across difficult cases, they don't feel ashamed at all or undermined to go and ask a colleague about opinion. You're coming and signed up for a junior level, junior position, middle grade doctor. Don't feel embarrassed to go to your consultant and say, I don't know. They are more than happy to help you. The problem happens when you pretend that you know and then you run into troubles. You won't have any protection if this happens because you're cooking things up and you're coming across as arrogant. Communication. The legal literature tells us that the vast majority of problems that happen in medical practice are due to poor communication. You're coming to a culture that loves to talk. Talk to your nursing staff, talk to your colleagues, talk to your seniors, talk to the surgeon, express your mind, speak up. Don't keep your ideas in your head. You have to communicate with people. I'll give you an example. Your call to A&E, to a trauma call, for example, and your patient is in an extremis and you need to rush the patient to theater. You don't ring anyone or call anyone upstairs in theaters. And the first time they are aware about this patient, when you're on their head with the patient needing to operate on him, it will go down very, very bad because you put them in a condition where they look like they are not competent enough. They are not prepared for an emergency life-threatening condition. And what you could have done is asking anyone in A&E to ring theater team and tell them, I have this patient, is in a very critical situation, get prepared, prepare this, this and that, and I'm coming up with the patient. They will value that. You're talking to them, you're communicating with them. So communication is of utmost importance here. Politeness, like I said, it's a polite population, not necessarily nice, and you will know when you come, but they are really polite. So you have to be polite with them, and they are expecting this from you. They might actually interpret all other cultures, including the Americans, as rude and direct. They are not direct here in UK, so you have to be polite with them. Be open and honest. If a problem happens with you, you have to talk about it. You have to file a critical incident and you have to reflect on the problem that has happened. Don't keep it and hide it because they will know. And if they will know, you will be in a really critical situation that a problem has happened. Know your limits, know when to call for help. Like we said earlier, communicate with your consultant. He's paid and trained and placed in his position, do his job, and he's happy or she's happy to do her job. So communicate with them. Appreciate the work and the expertise of others. When you come here, you will realize that the concept of the jack of all trades and master of none, when you have hands on cardiac, neuro, pediatric, pain, ICM, and you think that you can cover all of these, this doesn't happen here in UK. You have to be sub-specialized in one area, and then you will develop expertise. So if you come across someone that's expert in an area, value their experience, respect their experience, and use it. Work smartly hard. You need to work hard, but in a smart way. Know what takes you to the place that you want from the shortest pathway. If you're not interested in ICU and you've been offered a job in ICU, which is going to take 1 or 2 years from your life, ask yourself, why am I doing this? I'm not pursuing a career in ICU, so there is no point. I need a job in anesthetics in order to build my career in anesthetics. So when you work smartly, hard. And last but not least, make sure that you have some money in your bank account or pocket, because you will need a lot of it when you start pursuing a career here in UK. To finish with, like we said, plan carefully around your endeavor to come here to UK and have realistic objectives. Know what you're signing up for in order to have realistic expectations when you come. And like I said, your journey starts from the moment you arrive at the airport, rather than it ends there. It doesn't. It really starts if you're proactive and would like to have promotion in your career. And I wish you all guys the best of luck. And later we'll take some questions at the end from you. Thank you very much. And back to you, Dr. Mahdi.
Dr. Mahmoud, thank you very much for this outstanding presentation. I couldn't dream to have you today here. And one of the advantages of the Mega Online course, I know those talented people, Dr. Mahmoud Al-Kulani and Dr. Muhammad Al-Ridi and Dr. Huda Fawzi and Dr. Ahmed Abbas. Those 4 people, I knew them entirely from the Mega Online course. Dr. Mahmoud has shed light on your broad lines, how to get in easily in the UK system. Number 1, attitude. Number 2, communication. Number 3, you have to work hard. And I would like to add just a little point, because I am in the field already. As you are a consultant as you're coming as a trainee in UK, and you work as a consultant, because a consultancy is a fast track system. So you will find yourself in the age of 40, and your consultant is around 35 years old or 36 years old. Oh my God, should I listen to this guy? I know more than him. He knows very little. And actually, it is a system, you have to be obliged to work with him, because the UK system, I always tell the people, it is like a railway, either to be on the railway or to be out of the railway. So if you are out of the railway, you will not find any chance to work. So it's a matter of respect. You matter to have to work very hard, like Dr. Mahmoud, that he said, and you respect to everybody around you, even the porter who are carrying the patient around you. You have to say, please, thank you, and all of these are extremely important. The most difficult situation for our colleagues in the UK system, Irish system, never been experienced, never been how to put central line or spinal or epidural, always the communication. I'm pleased now to introduce or to offer Dr. Muhammad Ridi, who is going to have another presentation to you. And Dr. Muhammad, is all your floor now. Thank you.
Can you activate my camera, please, Dr. Mahdi?
Oh, sure, yeah, sure.
Brilliant.
Spotlight for you now, Dr. Muhammad.
Yes. Let me just share my screen, starting with. Bear with me for a second. Brilliant. That's it. Share. Okay, so starting with, I would like to thank Mahmoud for this very, very good presentation, thorough as well. He's talking about the broad lines of the training and the system in the UK, but I think it was very thorough. Second, I would like to thank Dr. Mahdi for giving me and my colleagues the opportunity to be part of the Mega Online course, and I think Dr. Mahdi and all who have been working on the Mega Online course are doing really, really great job. And the tremendous effort they're putting in is unbelievable. Trust me, it is really unbelievable. So without any further ado, let's start the presentation. So what I'm going to talk about today is the way to the UK, and actually it's not the UK, it is the GMC. So we're going to talk about the registration with the GMC and the ways to register, the routes to register with the GMC. To start with, I need to, let me just, point a few things. First of all, I have no financial ties with any of the locum agencies or any of the recruitment companies. And I think none of us has got any ties with any of these companies or agencies. And secondly, it's all volunteer work. We don't get paid or remunerated by any means. So all the mega course is just volunteer work from all the people who are involved with it. Lastly, I'm a PLAB examiner for the GMC, so please accept my apology if I can't answer very specific questions about the PLAB. I can answer general questions about the PLAB, but I'm not going to go into any details of it because that puts me in a better situation with the GMC, and no one wants that. So hopefully we will cover the routes to GMC registration. I'll give you some tips about the system, the loops and hoops that you will go through, save you some time and money looking at Google. And lastly, we'll take any questions from you. And please, Dr. Mahdi, if I run out of time, let me know so I can stop. So starting with, as Mahmoud has explained, this is the UK system. This is the straightforward system. If you are in the UK, you graduate from medical school, and then you start your foundation years. Your foundation years are 2 years, FY1 and FY2. And after you finish your FY2, you apply for a training job. When you start your training job, you're going to be starting as a core trainee. Some of the training jobs, they've got what we call a run-through a pathway. That means you don't have to apply for another job when you apply for a specialty training. So normally, in most of the jobs, you apply for core training. That would be 1 or 2 years, and then you finish these, and then apply for another job for a specialty training. Again, another interview process, and then you finish your specialty training, and lastly, you apply for your consultant job. Again, another interview process. There are parallel pathways. You can be either a clinical fellow or what we call a LAT, which is locum anesthetic training or a locum training post, or be a specialty doctor. And you can actually join the specialty training if you are a clinical fellow or LAT or a specialty doctor. So if you fulfill the requirements for applying for a specialty training, you can apply through certain routes. I'm not going to go in details about these routes because this is a completely different lecture, which is going to be, I think, covered either today or the next time we do this again. Again, you can also have, apply for a consultant job through a parallel route, which is called the Article 14 or the CSER route. And again, there is a completely different or separate system, which needs, I think, more than one lecture to cover it. So I'm not going to talk about it in details. Basically, you collect evidence to show that you've got the knowledge, the experience, and the skills to work as a consultant. You apply to the GMC, and the GMC send the paperwork to the college, your college, whether you're an anaesthetist or whether you are a surgeon, and you get assessed by a panel, all the paperwork you send, and then they respond back to the GMC, who again respond back to you to say, okay, your paperwork is absolutely fine. You can apply for a consult, and you can be on the specialist register, or actually your paperwork is missing some bits, and and you need more training in some areas, and you have to fulfill that within a certain period of time. So back to the registration with the GMC. When you go on the GMC website, and this is an actual screenshot from the GMC website, you will have 3 routes of registration. The first one is what we call provisional registration, which is basically for the foundation year doctors here in the UK, and this is that applies to the first year of the foundation year. So as an FY1, you apply for provisional registration. When you go to FY2, you become fully registered with the GMC. Most of you who are coming from abroad and you've got some experience and you haven't been through the PLAB process, you will apply for full registration, and we're going to cover that. The last one is the specialist registration, and this is either can be through the CSER pathway that we talked about, or if you've had training in the UK and you're going to apply as a consultant after you finish your training. So if you look at the full registration, again, this is a screenshot from the GMC website. So full registration applies to anyone who's going from FY1 to FY2, and applies also to the people coming from outside. Anyone coming from outside of the UK has to fulfill certain criteria, and these criteria are here. So the first one is, you can see here, completed the first year of foundation year, which is we've discussed. Secondly, or second criteria, be an EU national, and again, this can be changing soon with the Brexit, but for the time being, anyone who had an acceptable a medical degree from any of the EU countries can apply with the GMC. Or if you are an international medical graduate who had your medical qualification from outside of the UK and outside the EU, you have to fulfill one of these, which we're going to discuss in details. Okay, so the first one is by doing a PLAB test. Okay, the second one is finding a sponsor who is approved by the GMC. The third one is having an acceptable postgraduate qualification, and the last one is, as I said, the CSER pathway, which is again not easy to do all of it from outside of the UK. If you're going to apply from outside of the UK and even most of the EU countries now, you have to fulfill the evidence of knowledge of English. So you have to have some evidence of knowledge of English. You have to either do the IELTS, which is the International English Language Testing System, and you have to achieve a certain score in that, or they've introduced a new English test, I think a couple of years back, maybe more, called Occupational English Test, and again, you have to achieve a certain degree in it. There are some places where actually people have worked without getting these tests, and they are very special circumstances, and I know personally people who've done that. As I said, they are very special circumstances. So basically it's about the need. If the system needs certain speciality, and there is kind of very I would have to say that there is a very greedy need for the system for this speciality, the person can actually through the hospital can show them that they've got good knowledge of English, and the hospital would recommend them to the GMC to have a registration with the GMC without that test. It's up to the GMC to decide whether that evidence that the hospital has provided is acceptable or not. Okay, and as I said, that in the cases that I've seen, what happened is a person goes to do a clinical attachment. There is a very shortage, a very severe shortage in that speciality, and that person shows good attitude, also shows they are keen to work in that place, and the medical director would sit with that person and say, like, do you want a job with us? So that person will say, yeah, absolutely. I've got, you know, a master's degree in whatever, and this, all right, okay, how about English tests? So I haven't got an English test, okay, all right. And so they go through a certain form and certain kind of local assessment of English, and they have to provide that evidence to the GMC that they've done that, and the GMC is happy with that, and then they get a registration. But again, that is very, very rare. So going to the routes with the registration of GMC, we talked about the PLAB test. The PLAB test has two parts. The first part is written exam, and the second part is an OSCE exam. And there's loads and loads of information about the PLAB test online. And also there are courses that are, I think, can be done locally or can be done in the UK just before you sit the OSCE exam. I think the part that people fail mostly is the OSCE exam because of basically they don't know the system well, and that exam relies on the system and the communication and again the attitude, and you have to practice any exam. For any exam you have to practice, and this is not different. You have to practice for the OSCE exam of the PLAB test. So going back to again the routes of registration with the GMC, and I think this is the one that we get a lot of questions about, at least I get a lot of questions about, the MTI, which is the Medical Training Initiative or the sponsorship. So it has changed quite a few times, and the current situation is if there are a few sponsors that are approved by the GMC, and there are few programs that are actually been approved by the GMC for being posts for MTI or Medical Training Initiative. So if you are going to apply through one of them, for example, of these posts is a post with Alder Hospital, which is a pediatric tertiary center in Liverpool, and I'm running a bit behind the time, but just stop me if I run more, okay? And
okay. Take your time, Dr. Mohammed Ridi. Take your time, please. It's very interesting.
So, for example, as I said, Alder Hospital, which is a tertiary pediatric center, and they have a sponsorship program, and that has been approved by the GMC. If you go to that website, they will list all the sponsored programs that they have been approved by the GMC. Another scheme that I know about is Edinburgh Hospital. They've got, I think, a sponsored post in the intensive care unit that again has been approved by the GMC. Just bear with me. Sorry, I need to stop the timer. So the other way of doing this is by actually creating an approved post, okay? And that post has to be approved by the Royal College of Anaesthetists. I'm talking about anesthetics here, but that can apply to any Royal College. So, for example, looking at the Royal College of Anaesthetists criteria for an MTI post, you have to provide certain evidence, okay? You have to be an international medical graduate, been living and working outside of the UK and European Union for at least 12 months. You have to provide evidence that the last 3 years have been in anaesthesia training outside the UK and European Union, and so on and so forth. So basically what happens is that if a hospital wants to bring someone through the MTI of the sponsorship program, they create this job, okay, which is basically a training job. So during your stay with the hospital, which is most of the time either a year or 2, you will get some sort of training, okay? And you will get assessed every 3 months or 6 months, depending on how it works, by the college tutor of the hospital, and to see if you're actually fulfilling your training requirements or not. And that post will be created. They will put all the criteria in it, and they will put also what you're going to be given in terms of training, okay? And they will put everything and send it to the Royal College of Anaesthetists. If the Royal College of Anaesthetists is happy with the post, they approve it and they say, yeah, it is an MTI post, okay? So what happens is, and this is what happened to me, and I think Mahmoud and other people that I know, you speak to the hospital, get the job, okay? And then the hospital speaks to the Royal College, they get the, and you speak to the Royal College and say, right, I've got this job, which is an MTI job. And the college says, okay, yeah, we're happy that this is an MTI job and we are going to sponsor you. And then the GMC speaks to the college, or the college speaks to the GMC saying that we're going to sponsor this person on an MTI job, and please give them full registration with the GMC. The MTI jobs, as I said, it's either 1 year or 2 years. You come on Tier 5 visa application for the time being. I think the visa application system will be changing soon to a point-based system. I'm not sure about the details of that because this is something very, very new. Okay, most of the places will require some sort of proof of knowledge, some sort of postgraduate degree. I'm talking mainly about anaesthesia. So, for example, a master degree from Egypt is acceptable for most of the places in the UK. There are other sorts of eligible or approved postgraduate qualifications, which is also on the website of the GMC. Again, it's up to the hospital to say, actually, this is an acceptable postgraduate qualification or not. Okay, so the hospital can say, yeah, this is acceptable, we were happy with that, or not. Okay, moving on, this is a list of the acceptable postgraduate qualifications, and this is on the GMC website. Again, there are loads, and most of them, as I said, are exams that are done after in a specialty that you are practicing. So, for example, here, the UK postgraduate qualification that is approved by the GMC is the primary FRCA exam for anaesthesia, and you can do that, I think, nowadays completely out of the UK. I mean, you do the MCQ. You don't need to be working in the UK to be able to do the MCQ, and then also you can do the OSCE. Just you need to fly to the UK to do the OSCE, and again, you don't need to be working in the UK to do the OSCE. So you can do it, all of it, while working outside of the UK. Okay. Again, other examples: membership of the College of Emergency Medicine and membership of the Royal College of Physicians. I know that the MRCP can be done completely outside of the UK because of the some centres in the world that do it like the whole of it. Overseas qualification, the certificate of the American Board of Anesthesiology, European Diploma of Anesthesiology and Intensive Care. Again, this is approved qualification for sponsorship post. Fellowship of the faculty of the College of Anaesthetists of the Royal College of Surgeons in Ireland. So if you're going to do the fellowship of the in the Royal College of Surgeons in Ireland, you can apply with it for a training, not training post, for an MTI post or registration with GMC. So going back to that system, I'm just going to try to point you to the exam and where it fits. So if you're going to do the PLAT, and just bear in mind, once you start PLAT, you can't do anything else. So what I mean is, if you've done like the first part PLAT and you've passed it, you've done the second part, but unfortunately you failed, and you thought to yourself, oh right, I'm going to do another exam and apply through the GMC with it. You can't. Once the PLAT, it has to be PLAT. If you've got an MTI with sponsorship, you can apply for court training, but that would be through the hospital. It's not going to be a court training through the UK system, but it's going to be a parallel system to the training system, but you still can get training with it. What do you need? You need a proof of knowledge. Okay, for example, the European Diploma of Anaesthesia and Intensive Care, which again can get you a clinical fellow post or a specialty doctor post. Okay, what I mean is, with the European Diploma of Anaesthesia and some postgraduate degrees, you may not need a job to apply for registration with the GMC. You can apply directly with the registration of the GMC. And as I've shown you before, this website, which is the GMC website, again, this is a screenshot from the GMC website, has got a list of the qualification that will grant you a full registration with the GMC with license to practice. Okay, so bear in mind, you have to be within 3 years of passing your postgraduate qualification. Can you get from here to get specialty training? As we said before, yes, you can do. and there are certain things that you need to fulfill before you go into that. One of them, for example, in anesthesia, you have to get the primary FRCA. So if you've come to the UK, you had your registration with the GMC with the European Diploma of Anaesthesia, and you've got full registration with the GMC, you got a job as a specialty doctor or a clinical fellow. Okay, you fulfill the criteria to apply for specialty training, but you don't have primary FRCA. You can't apply for that. So you can't apply for specialty training without primary FRCA. However, you can try to do a CSER and apply for consultant post. It is strange, okay, but for the CSER, obviously, there are more requirements in comparison to specialty training. There are more paperwork, okay? You need to fulfill a lot of requirements, and it is a process that will take at least a year or two to finish. So I'm coming to the end of my presentation here. So again, as Mahmoud has shown you some resources for job search, most of the jobs can be seen on the NHS jobs website. And now it is mandatory for all the hospitals to advertise for the jobs. So mostly, if not 100%, the jobs has to go on a public website like this website. Some tips: do your homework. Okay, as Mahmoud shown you, it is not easy to find the right job. Okay, that means that if you are interested in anesthesia and there's an IT job, you think you're like, right, I can get to IT and then get to anesthesia. Yes, you can do that, but remember that during the first year or the second year, you will be doing intensive care medicine. Don't ask for anesthesia while doing that, because they will not be happy to give you that, because you're asking about something that is not in your contract. Okay, yeah, they can give it to you if they are nice, but it's going to be completely for them to decide whether you can be posted or put into an anesthetic list or not. Okay, so do your homework. Look at the hospital. Where do you want to live? Is it a district general hospital? Is it a tertiary hospital? So what specialty do you want? I want regional anesthesia. Do they have regional anesthesia service? Ask. It's easy to send an email. There's no harm of sending an email out. Ask the clinical director. Ask the department lead. Ask the people who would tell you whether this is the right job for you or not. Secondly, prepare your CV well. Okay, so there are certain things in the CV that especially the GMC, don't understand. In our culture, in our countries, it is normal to be working, I'll say, 2 full-time jobs. Okay, if you look at it, it's not 2 full-time jobs, because you can't do that, but you can say that most of the week you're out, you are working, and you're actually doing 2 full-time jobs. The GMC doesn't understand that, because it's very hard for someone to work 2 full-time jobs and be safe at the same time. So look at the hours, how many hours you're doing. If you're going to put that in your CV, look at the hours. So for example, if you're doing 50 hours in one hospital and the rest of the week in another hospital, just put it like that. Put it in hours. It's easier for them to understand it like that. Okay. Always negotiate the terms of your contract. So what the medical staffing will do, they will just look at you and just make you start from the bottom, okay, of the pay scale. And you have to speak to them, say like, I've got experience. This is my experience. These are my certificates. You can't do that to me, okay? And just try to negotiate your contract. However, don't do that before you get the job, okay? Never ask about the salary before first of all, your interview or before you get the job, okay? After you get the job, after you register with the GMC, just try to initiate your contract. And it's mainly medical staffing that you will need to speak to. Lastly, have a plan. Don't come to the UK without a plan. You can be stuck somewhere forever, okay? And why I'm saying that? Because I've seen people who've come here, okay, they didn't have a plan, and 15 years later, oh, I missed my boat. Don't do that, okay? have a plan. Say, all right, I want to be a consultant. This is what we need to do. 1, 2, and 3, and 4. Of course, things change. You know, life is dynamic. Our social and economical abilities sometimes can, you know, make us do things differently. But at least have a plan to where you're going to be, like after 5 or 6 years. Okay, and don't leave yourself just to work without a plan. Again, I cannot stress enough on keeping record of what you're doing. Even if you're in a new country, a logbook is mandatory, is essential. If you search Royal College of Anaesthesists logbook, you can download it, you can put it on your computer, you can put it on your phone, and you just use an app or something that can keep log of the cases you're doing on your daily basis. It is mandatory. If you attend a conference, if you do teaching, even if you attend a teaching, just to keep record of it, and that will help you when you apply to the hospitals. I think that's it. As Mahmoud was saying, that we're going to take the questions at the end. I hope that was not long. I know that I've overrun my time. The phone kept telling me. I'm really sorry if I've overrun.
Not at all, not at all. I think I'm going to change the activities of the Mega Online course to UK and Ireland career pathway by those listening to those very interesting and more than academic lectures in the career pathway. I really enjoyed them. I couldn't add any more. This systematic way from Dr. Mahmoud and Dr. Muhammad Reedy pinpoint about every single point. Absolutely fantastic. And we're going to take some questions now. We are joined actually by Dr. Adil Ibrahim. He is a professor of anesthesia in Emirates, and he is going now to take some questions as a moderator. We enjoyed his accompanying in the last few sessions in the Mega Online course. I'm so delighted for him to take over some of the questions. Let me first to ask one question here. I'm not sure it's been asked before. How to become intensive care consultant post super specialty degree in critical care from India pathway is the same. I think that's been asked before or answered before. I am interested in pursuing a career from intensive care medicine in UK, and I have completed my MD in anesthesia critical care from Tata University Hospital, Mumbai. Kindly explain the process I would have to go through. I think that being answered, I believe so, right?
Yeah, just want to stress one thing is that you need to go to the GMC website. You need to have a look at the list of approved qualifications, because you will be surprised what is in there. Some countries and some departments specifically has been very active in terms of getting the certificates accredited by the GMC. So just go in there and see what you can do. However, to become a consultant, as I said, you have to fulfill certain criteria. Either you join the specialty training in the UK, or you have to apply for a CSER, and that applies for the intensive care medicine as well. You have to fulfill the requirements for the CSER through the GMC and through the Intensive Care Medicine Society.
Dr. Mahmoud?
Yeah, I'd like just to second what Dr. Reedy has just said. So you guys, you have to do some homework. And the system works sometimes in a funny way, unfortunately. So for example, something like EDIAC, a lot of you guys are asking about it. It can give you GMC registration, but unfortunately it can't help you to join the training program anymore. But later, if you're doing CSER and you have it on board, you can use it as a test of knowledge in order to become a consultant. Sounds funny? Yes, it is, but this is how the system is. One more funny thing, a lot of you guys come to the UK with their BN diploma of anesthesia, and then you become eligible to set the final FRCA exam, and then you realize, okay, I'd like to join training. When you have the final FRCA exam under your belt, you'll have to go back and do the primary FRCA exam in order to join training. Funny? I agree, it's funny, but this is how the system works, and we have to abide by the rules, really. So go and do your homework, check your certificate, whether it's accepted as equivalent test of knowledge towards CSER, and whether it can qualify you to do GMC registration or not. Those are two different entities for most of the degrees. the only one that can make you join GMC, like register with the GMC, and then join training is the primary FRCA, nothing else. They wanted to make the system here in England very, very specific to England, especially with the knock-on consequences of the Brexit. So this is how the system works. Do your homework.
There is another question, if you don't mind, incoming on question and answer. In case that I made my registration in the GMC with ADIAC, can I join training in another specialty? I think like GB, I think that's been answered already. I'm not sure how come he joined from ADIAC to GB training. I think that's quite difficult.
I think
Actually, yes, it is all right.
yeah, it is all right. And for Ahmed Kandil, who asked this question, the demand for general practitioners here in UK is really high. It's dead easy to get into general practice, and it's a very smart choice if you'd like to have easy life. But Ahmed, coming to UK will cost you a lot of money. You have to be focused on your goals and know where you're heading exactly. You know, thinking about putting your fate here in UK and then you can take it from there doesn't always go right. I know even cardiac surgeons who gave up being cardiac surgeons and became JPs. So please focus on your goal and know exactly what you want. General practice is totally different from anesthetics, critical care, and pain medicine. And you can actually, instead of spending money and effort on the ADIAC, know how to get into general practice. We're not in a position to advise you on that because we're not general practitioners. But what I can say with confidence, I know loads of people who've been through other subspecialties and ended up in general practice, and the demand on general practitioners is really high. So it's very easy for you to get into it if this is your aim and goal.
Yeah, just again, we're going to be, seconding each other, but I just want to second Mahmoud and say that actually you can't, the knowledge or the test of knowledge is just for you to get registration with GMC. What do you do afterwards with it? It's completely up to you. So because some of the specialties here are very, very competitive. For example, most of the surgical specialties, and a lot of people don't get a specialty training, just do go through core training and they can't get into specialty training. So they change the specialty, which is very common in the UK. So yeah, if you get registration with the GMC, by whatever means, you can change your specialty.
Next question from Dr. Gupta. My name is Dr. Gupta. I am practicing neuroanesthesiologist in TAN in Mumbai, India. I have done fellowship in neuroanesthesia certified by whatever maximum super specialty hospital. I am managing neurosurgical neurointervention. I'm looking forward to start my career in UK as an anesthetist. So what should I do? You know, and I think we have been talking about that all the time.
I think it's been covered thoroughly, isn't it?
I think Dr. Rida and Dr. Kulani, you did a wonderful job. And one of the more points I would like to insist, and you mentioned that already, that documentation. And we have lots of CV coming from University of Cairo, University of Mumbai, University of Uganda, and we don't know which one you are. Don't overdo your CV. Don't overdo your CV. Otherwise, people write that I have been working here, I have worked there, and nobody respects. I have been working with that professor, and I learned a lot from this professor. No, just your technique. What have you done by yourself in your CV? Extremely important. And don't overdo your CV. Otherwise, once you are, for example, you wrote that you are looking after this kind of patient and you have been put in theater to look after those patients, you fail. So that's it. Okay, Dr. Mahmoud, you can
add? Just a quick thing that struck my mind, Dr. Mahdi. So unfortunately, what happens with most of us, we come here to UK after a good number of years of practice, but it's a very specific system that cares about safety a lot before anything else. It's never a one-man show. We work in teams. Like I said, there is a consultant available all the time to deal with problems. So you might be experienced. You might have 6, 7, 8 years or even more. You might have already started working as a consultant. You're expert in a subspecialty. But when you come here, you signed up for a junior middle grade doctor position. You'll be questioned about every single thing until they know well that you are safe to do your job and you abide by the rules while doing things. Because they don't want someone that's, you know, depending only on pulse oximeter to anesthetize patients, because this is what we do in our place, or these other sources available, and then you run into trouble. You'll be questioned. This is substandard practice. They don't want that. They want to make sure that you're safe. They want to see that when you do a central line, they don't care if you do it in 1 minute. What they care about is this patient is not going to get infection related to the central line after you put it. They don't want to see you doing an arterial line in 30 seconds. What they want to know is this patient is not going to develop ischemia and is not going to get infection related to your arterial line. So they'd like to know that you're a safe doctor. So you'll be questioned about every single thing that you do, every single procedure or intervention. The other thing as well, be open-minded and downplay your game until people know you and know what you can do. There are subtle differences between our culture of practice and how things happen in UK. For example, you will find a medication like metformin. It's like the Aramine. It's the bread and butter of vasopressors here in UK. Know how to use it, okay? RSI is like Quran and Bible in UK for patients with potential full stomach. Yes, the evidence behind it is not that strong, but don't be a newcomer to UK and then you say, no, I'm not gonna do it because this is how I do things. It's not gonna go down well. So downplay your game, know how things are being done in the UK, build your rapport, build your bridges, make them understand that you're competent, safe person, and then they will let you go on your own afterwards when they trust you. This is what they need to see in you while practicing here in UK.
I can't agree more. And then also, again, in your CV, be honest, okay? And then be honest afterwards. So if you haven't used an ultrasound before to put a central line, be honest about it. Say like, I haven't used one before, teach me. If you haven't done regional block under ultrasound guidance, don't say like, oh, I can do this, you know, I can do that. And then when you actually hold ultrasound probe, you don't, you know, you don't know how to use it. That one, as Mohammed said, won't go down very well. So be honest about your training, be honest about what you can do, what you can't do, and just ask for help when you need it. There's the consultants will ask for each other's help, because as Mohammed said, like, we work in teams, we don't work individually, we work in teams. The priority is for the patient safety, okay? And this is what you should have as a priority. The patient safety is the first thing you have to think about. And no one will argue with you if you say like, I need help. No one will say, oh, you don't need help, you're all right with that. No one will say that to you. They will come and help you, okay?
One more thing, Dr. Reedy, Dr. Kulani, and Dr. Adil. I give you a life example with myself in theater. I have been joined with one of my colleagues. He came to us, and he's a little bit senior man in his position in Saudi Arabia, and unfortunately, and he is working in a very good hospital. Put the cannula on the patient, give propofol before the nurse connecting the monitor to the patient. And the nurse came in the corridor shouting at me that how come this trained doctor put the patient asleep without seeing the basic monitoring ECG, pulse oximeter. And I talked to him and he said that, well, I'm doing that all the time. I told him, here, you are here in the system. And, you know, don't repeat the mistake twice. That's the other thing. And he, after the second patient, he repeated the same mistake. So he was done. You know, that's finished like that. So repeating the same mistake with the same attitude, the same communication is extremely wrong. The other thing, just catch me here, you know, we all know in our countries, we put two patients sleep at the same time. We can look after this patient here and that patient there. Sometimes people leave the patient with the nurse and they just look at the blood pressure. I am here, I'm superhero doctor, I'm superhero anesthetist. Never happened in my place.
Yeah, and like they say, Dr. Mahdi, speak Roman when in Rome. Know what how things are being done in this system and abide by it. Because you're a single person in front of a system. And trust me, the English people are very proud about their system. They are very proud
Absolutely.
about how they do
Absolutely.
things. So it's no brainer to try to resist this system or think you're going to beat this system. It's not going to happen. You will end up, you're being watched from the first moment you enter theater. The feedback process is ongoing. And a lot of people, including nursing staff, are well trained in human factors, and they will go and give feedback about you. You don't want to build bad reputation from the beginning. You'd like to buy yourself good reputation that speaks about you in the future. And like I said, when they trust that you're a safe content person, they will say, okay, go ahead. We know that you're senior, you're a content person. We're happy to have you around doing work. So this is how you have to play your game. Know how things are being done in this system and abide by them. I remember personally, when I came to UK, I had the ACLS, the American Advanced Life Support course, not the British one, not the European one. And the timing where you were used to giving adrenaline was different. And during cardiac arrest, when I tried to do this, I was stopped. And the nurse is put in a position, is trained to stop you. She will stop you. And that's her position, to say, no, you're doing something wrong, despite the fact what I was doing was coming from the ACLS recommendations. It's not something from my head, but this is how they do things in this country. So I went and I had an ALS and then moved away from the ACLS because I'm practicing in UK, nowhere else. So these are the subtleties and the differences between the UK system and other places, and you have to abide by them if you'd like to have an easy, successful career in UK.
Can I add one more point, please, Dr. Mahmoud? I don't agree more than what you said. But when I am in the hospital, or I find if I'm Indian or Egyptian, and I find my consultant is the same nationality, oh, fantastic, he might uncover me, you might cover me. So never, never, ever believe that. Okay, so it might be worse actually, because because it would be difficult to put him under pressure that you find somebody from your nationality as a consultant or direct consultant. So everybody protect himself, and the main target is the patient. Healthcare system, we are all working in the same system. Nurses, porter, doctors, and even the patient himself in the system. And all the care directed to the patient, not for the consultant, not for the trainee, not for the nurse, all patient-centered care.
Yeah, just wanted to. I've just quickly had a look while you were talking at the questions. There's some questions about. Do you want me to answer them, Dr.
Please
Mahdi?
do, yeah, please.
All right. So some questions about the logbook. Can we document retrogradely? Yes, you can if you have the evidence. Again, be honest, okay? If you basically put something in your logbook that didn't happen, and it turns out that actually you're lying, it's going to be very bad. You're going to be actually sacrificing your GMC registration. It is an issue of property. You can't lie. Okay, so if you're going to document something, it has to be something that has happened, and you can support that with evidence. There's some very specific questions about income and salary. I would say that to go to the BMA website, the British Medical Association website, they have all the information that you need about the salary grades and how much each grade gets paid in terms of training and non-training jobs. Can I apply for, which is better for me if I want to do a Caesar fellowship or specialty doctors? So again, it doesn't matter, to be honest. A fellow job is you are gaining, you're being treating as a senior registrar, and you're sometimes going to be put on list on your own. It's up to actually how you're going to communicate with the department in terms of your educational needs. So if you're a senior clinical fellow and you want some needs, you have to communicate that with your department, the college tutor, the education supervisor, and they can accommodate that. As well as being a special doctor, you have to be proactive. in your contract as a specialist doctor, just be aware that you are a service provider. There's no training in it. So anything above that would be up to the department to deliver. It's not something that they're obliged to. It is something that at their own discretionary. So they can say, yeah, we can help you, or no, actually, we cannot accommodate your needs. And as Mahmoud was saying, the trainees come first. Their needs has to be fulfilled first. Do you want to answer some questions, Mahmoud?
I already did answer while you were giving your lecture, number of them, and I'm still answering.
Okay.
Them. So I'm okay. I'm just asking, is Dr. Fauzi around to start her lecture, or
Dr. Huda is not here actually. I didn't see her, and I think she is not able to join us. I believe so.
So I think we have now one of two options. Either
Yes.
do the next, carry on chatting and answering questions,
If
or
possible.
carry on doing the last lecture about training, joining training.
Yeah,
and
I
then
would be
have
delighted.
enough
Yeah,
time at the end for interaction with audience. What do you think, Dr. Mali?
I will be delighted to do whatever you. It's all the floor is yours. You know,
What do you
if
think?
you are not tired or anything, you can go ahead. You know, I never stop any help for our candidates. You know, they are all here. They are very respectable and they pay their time to join us. So we have to help them as much as you can, if you can.
So what do you think then? Shall we start the last
Dr.
lecture?
Mohammed Ridi?
Yeah, I think if you start the last lecture, because it will give a lot of answers to, or a lot of questions,
Okay.
and then we can take questions afterwards.
Okay.
Right.
Thank you very much.
I'll share my screen and start then.
Thanks in advance. Thank you.
Right, guys, unfortunately, you'll have to bear with me another 20 minutes while I'm talking. So welcome to my second talk today, which is joining the National Training Program. I think this question, a lot of you guys are asking this question. So I'll try to answer what's on the top of your head about it. First of all, what's the National Training Program? So that's a 7 years program in UK in anaesthetics. It runs in different regions. So for example, I'm in northwest of England. So following the Health Education England Northwest in Liverpool and Manchester, I'm in Manchester. Dr. Radi was in Midlands. Other guys might be in Northeast. Other guys might be in London. Some regions are too big, so they are broken down into many other sub-regions like Yorkshire, for example. So it runs in different regions where you're allowed to rotate between hospitals in order to fulfill the modular needs of the curriculum of training by doing the subspecialty in the hospital that offers it the best. So for example, you will go to the neuro center that does neuroanesthesia in order to do your module there. You will go to the cardiac center that does cardiac anesthetics and thoracic anesthesia to do your module there. You will go to the best place doing obstetrics, like Dr. Reedy, for example, pursued a prestigious fellowship at St. Mary's Hospital in Manchester, which stands very, very well in his CV when he's applying for a consultant job. So you will get your needs in the best place that can offer this module. It's broken down into 2 years of core training. If you've done 18 months of anesthetics anywhere in the world, you won't be allowed to apply for core training. In the past, it used to be called SHO, Senior House Officer. But if you've done 18 months or more, your access will be to the registrar level as an ST3, and this runs into 5 years. At the end, you will be offered completion of training certificate. And when you do CSER, you're trying to mirror this program. And this gives you an idea that theoretically it's easy to talk about CSER, but actually in reality, it's a lot of hard work. As a trainee, I'm supported by the system. The system is looking after my needs. In other words, pampering me really, while you as a CSER applicant, you're doing a lot of effort on your own. So it's your proactivity and your own effort in order to mirror what I'm being offered. ICM, like we said in the previous lecture, it's a side stream, it's a different program. If you'd like to apply as an anesthetist for ICM, it's another number with another application in order to have dual training. And there is a lot of overlap between the two programs, but you have to do specific things in ICM in order to say, I'm content to be an ICU consultant and an anesthetic consultant. By name, you'll have to do a little bit of medicine, acute medicine. You'll have to do subspecialties like pediatric ICU, neuro ICU, cardiac ICU, and so forth. In terms of pain, it happens within the training program. So you do it at different levels. You do it at an intermediate level. Then you move to a higher level and you do a lot, some pain as well. And then you have a full advanced year of training in pain medicine. And even after finishing your training, if you'd like to pursue what we call post-CCT fellowship, in this particular subspecialty, you're free to do that if you'd like to boost your CV or you think you need a little bit more to do that. This happens more for the local English applicants because they have been only through this training program, while for you as an overseas person, probably will have experience behind you, so most probably you won't need to do this post-CCT fellowship, but it's always up to you. How to join? That's a very, very important question. So that's actually a very structured application. It's totally different from the non-training job. The reason why UK has non-training job category in it is because of the demand. They need a lot of people to maintain the manpower and maintain the standard of care. And this is why they are happy to employ overseas doctors in non-training jobs to fill in the service, the needs of the service, to fill in the gaps in the on-call rota, and to cover theaters as well, but they don't have any commitment whatsoever to your career progress or your educational needs. Like I said earlier, it's a teaching environment in general, so rest be assured, you won't be ignored, you won't be asked to do the dirty work. In other words, no, they will look after your needs, but you're not the priority, and you need a lot of proactivity from your side in order to meet your needs. While the training program is different, it's a structured process. For anesthetics, they advertise the jobs twice yearly, in February to be interviewed to start in August, and in August to be interviewed and start in February. The numbers are not limited. It's a highly competitive process because you're competing with your English counterparts who've been in this system since they were in school, actually, not only uni and not only in training. You have to apply through a system called Oriel. So you go and sign up to the system and keep an eye on the advertisement of jobs. And then you have to fulfill certain criteria in order to be shortlisted. We mentioned some of them already, like the FRCA exam. And then you have to do something called self-assessment, where you score yourself in different categories of work. And then depending on your paperwork, the self-assessment, something called equivalence of basic level of training certificate, if you're applying for ST3 job, which you sign after you have equivalent test of knowledge, and you have initial assessment of competency in anesthetics and obstetric anesthetics, and then get this piece of paper signed by the regional advisor. When you have all of these together, you'll be shortlisted for an interview. For ICM, it happens only once every year, so you have to keep an eye and apply when the door is open. For pain medicine, like I said, it's part of the training, so you don't have to apply separately. The interview process, it's a very, very tough interviewing process. So you apply in anesthetics and you put preferences, and then you will be interviewed in your first preference. It's like an exam. It needs a lot of preparation for us as overseas applicants in order to bridge the gap in language. And by language, I'm not talking about vocabulary and grammar. I'm talking about what's behind language. You have to do a lot of practice, interview practice, attend interview mock courses in order to teach you how to behave. They liken the interview process like salesman, like car salesperson, where you'd like to, sorry to say that, but you'd like to blind your customer on the dent in the car. All of us have dents, okay? Let's agree on that. You'd like to blind the eye of the customer on the dent on the car until he buys this car. You're performing your best on that day, competing with everyone in order to get the score that makes you appointable, and then they can offer you a number. They don't mind at all if they keep the numbers without offering them to anyone, because they are very precious numbers. So you have to score a cut-off score in order to be able to get into the job. For ICM, the interview happens in one place, most probably in Birmingham. So they bring people over a few days from all over the country and they interview them. In anesthetics, it happens in different regions. It's 3 stations for anesthetics. They do what's called presentation. So you're giving a topic where you can prepare it in 10 minutes, and then on the day, you don't know about the topic, so they give you a topic, you prepare it in 10 minutes and then present it in 5 minutes, testing your presentation skills and working under pressure. And they will ask you a few questions, might be or might not related to your presentation. So you have to practice that and keep time because they won't allow you extra time. Then you do a clinical station, which might be about a clinical scenario. And this comes to our advantage as overseas applicants experienced and trying to join training, or a prioritization scenario where you're the most senior person in a small hospital and they'd like to know that you're safe, you know the resources available and how you're going to do them. So you're dealing with more than one emergency case and how you're going to prioritize this. And there is no wrong or right answer here, but it's just how you're able to use your resources and the people available in the hospital. And then portfolio. So you have portfolio of your achievements, you present them based on your self-assessment, you present it to the panel, they go through it and see whether you're scoring yourself the right score, higher or lower, and then they ask you a few questions. And in their hands, actually what makes it a tough process is the fact that they have numbers in their hands called overall global score. They assess your personality, how you come across, your confidence, all the non-clinical personal traits in your personality before offering you this number. And they can fail you if they think you're not fit for purpose and you cannot do the job. In ICM, it's 5 stations. On top of these stations, they give you a reflection station where you sit down and do reflective practice on things. And you have prioritization station as well. What are the chances? The chances actually are massive at the moment. Just to let you know, last time during the applications, because of the COVID-19 problem, they employed people based on their self-assessment. So they didn't do any interviews for them, which was a huge chance for everyone to get a number. And after Brexit, actually, you're now competing with the English applicants, but you and the European applicants are at the same level. In the past, when I applied and when Dr. Reedy applied, I had to wait for the English applicants and European Union applicants to get the number and be settled and happy with everything. And then I get offered next. Frustrating, it is, but this is how the system works and we have to abide by it. You have to have the primary exam. We focused on this. So you have to finish the exam before applying. Theoretically, you can apply before finishing the whole exam, but you have to make sure that you're going to pass it in order to get the job. Most of us will join at ST3 level, and then you can negotiate some exemption on time and training based on any achievements that you have achieved out of your training, and they are more than happy to move you up through your training. If you're more junior and listening to us today, just finishing your internship or so, you can join the core training and start the program from scratch. And this maximizes your chances of getting a registrar job afterwards because you're already rotating between hospitals and networking with people. But if you've done 18 months plus in your subspecialty, you're not allowed to apply for your ST3, your core training, and you have to go for registrar level. We said before that for ICM, the intake is from different subspecialties. So you can be an anesthetic trainee, you can be a medical trainee, or you can be from certain background called ACCS. It's like common STEM for all the acute specialties for those who are not sure what they are going to pursue later, and they can apply for ICM, or if you're doing emergency medicine. The important question that we all ask, why? And I always reply, why not? It's no brainer, guys, come on. You're being pampered by the system. It's a clear pathway. Yes, we'll say later in the flows of this process, but it's a clear pathway towards clear objectives. You're allowed to rotate between hospitals to meet your own requirements. You're privileged. Every single person in this hospital with educational commitment is looking after you and making sure that you're fulfilling your training module and you're signed off at the end of your placement in order to keep going. Your completion of training is guaranteed while you're doing Caesar. Like we said, it's your own endeavor. It's doable. Don't get me wrong. I'm not putting you off doing Caesar. It's very doable, and we have loads of amazing colleagues who are really brilliant, who've been through the Caesar pathway and they achieved it or about to achieve it. So it's doable, but this is a more guaranteed pathway. Again, you have easy access to specialized areas. So I've been to pain medicine training. Dr. Aradi has been to obstetrics, perioperative medicine, and regional anesthetics. And I'm doing a little bit of regional anesthetics, and I've been doing other things as well in addition to pain and anesthetics. While if you're doing Caesar, you might not have easy access to specialized areas of training. So that's another privilege. What's massive actually in this process? Networking, social networking. You rotate between hospitals. People know you and you know people. And whenever you go to a hospital and you think there is a potential for you in this hospital, you can touch base with them and say, I like your hospital. I think I like to work with you in the future. And then they will consider you and consider offering you a job when you're eligible to be interviewed and offered the job. While if you're doing Caesar, most probably you're confined to one hospital, to at best maybe in 2 different regions, and you don't get the chance of building this social network with people, speaking to heads of departments and people in hospitals. They know you, you know them, you express interest to them. So it maximizes your chances of getting a consultant job later. What are the stages? Like we said, you start with core training if you're eligible to apply for core training, and that's for 2 years. Then you enter the specialty training, which happens in a spiral manner. So you do all the modules at different levels, intermediate, then higher. And then you have an advanced year of training in your area of subspecialty of interest. If you're doing ICM, your training will be extended a little bit to cover the other areas that need to be covered in ICM. We call the year 3 and 4 in specialty training intermediate. And then you have a certificate that you completed this stage. And then you move to the next stage, which is year 5 and 6. And we call this higher training, during which you have to finish your final FRCA exam in order to progress. Previously, the FRCA final exam needed to be finished earlier, but they extended that because a lot of people failed to finish the exam and they might get a little bit of delay in their progress. So they extended that a little bit, and then an advanced year, and then you're done with your training. You get your completion of training. And for those interested, in the past, we used to have something called Caesar CP, even if we are combined program, because you didn't do core training here in UK. This has changed it for anyone listening to us and interested in this point. As a trainee, you're going to get a CCT. This is not the case for ICM, unfortunately, for various reasons. I'm not going to expand on this. But as an anesthetist or pain specialist, you're going to get a CCT, like someone who started the program from scratch. How's your progress assessed? You're always being assessed. It's an objective program. It's based on the curriculum designed by the faculty, designed by the Royal College of Anaesthetists, which, by the way, is going to be changed very, very soon to a new curriculum. There are modules in each subspecialty that tests knowledge, skills, and your attitude is being tested actually all the time because you have to collect feedback from your colleagues. You have to collect feedback from your consultants and put this into your portfolio. It's an electronic portfolio where you record your workplace-based assessments, depending on the module you're doing, record your lookbook as well, collect this feedback, and annually you'll have something called Annual Assessment of Progress, ARCP. It's a panel set up by the school, the specialty in your region, and they will go through all your paperwork, and then they decide that you achieved what you need to achieve, and you can progress to the second stage. And how to apply, like we said earlier, finish the primary FRCA exam, prepare your portfolio for the application of the training number. It's online application, so do your homework and sign up for the oral system. The link is available, and I'm happy to share my presentations with you to find all the things that we talked about. Interview practice. It's a different culture. My kids are able to do presentations now, okay? They can do a PowerPoint presentation because this is how they are taught in school, right? We haven't been raised up in this system. So you have loads of gaps, and under stress, the stress of the situation, those gaps come to the surface. So in order to be able to control these gaps, you need to practice as much as possible with your consultants in front of the mirror, Record yourself on your computer with your wife at home, or with your husband. You might seem crazy while you're doing that. Yeah, I agree, but you need to do it. You need to be able to speak in order to perform well on that day and be appointable. Talk to people, do your homework. Most probably you'll be on a non-training job and no one else in the region, no one in otherwhere in the region knows you. Touch base with the training program director and express interest that you'd like to apply. Tell your college tutor in the hospital that you'd like to apply. Speak to the head of school, speak to the regional advisor. One of these, at least, if not all, will be on the day of the interview. And if you canvassed for yourself and you said, okay, guys, I'm interested, I'm gonna apply, they will say, okay, this guy's keen. And they will start asking about you, and they might get, well, hopefully they will get good feedback about you, and they will be keen to appoint you if you do well on the day and you meet all the criteria. So talk to people and build this relationship and get the score on the interview day. You have to. Like I said, they don't mind keeping the numbers and not offering them to anyone and filling the gaps with non-training candidates in order not to decrease the standards. So the standards are high and they are not willing at all to ease these standards. Maybe COVID-19 was a bit of exception in that, but I don't think this is going to happen again. So where is the flow then? Where is the mistake in our culture when we think that it's too good to be true? We're always, when we get a deal, we always search for the problem in this deal. And there are some flaws, but it depends on your personality and your way of thinking. It's lengthy. If you join as an ST3, you don't necessarily get exemption in time, and you might have to do the 5 years, and you might have under your belt like 6-7 years of experience before this point. You have to buy into it if you'd like to go through the system. A lot of commuting, a lot of driving in the awful British weather. I'm talking to you and it was raining like crazy outside today. Imagine you're during winter time and you have to commute every day for 50 miles plus in each direction after a long day or after night shift when you're knackered and tired. And the most comfy place will be behind the steering wheel and you're falling asleep while you're driving. Many of you might be aware about the new focus in the system about tiredness, sleeping. Even in the new contracts, there is part that puts legal requirement on the hospital to provide rest facilities for the trainees because people died while going home after their shifts. You will be hitting the motorway while you're very tired, while it's dark. Darkness here and during winter time starts around 3, half 3, might be raining like crazy or even snowing. And you'll have to do this every day. Some people do it for a year, maybe more. And so you have to be happy to do that because probably you're not going to move your family with you if you have family with you all over the place. If you're single, that's easy. You can go and rent a room or somewhere close to where you're working and keep doing that. But if you have family and would like to look after their stability and continuity, probably you will base them somewhere and then you will commute to wherever. So that's a lot of commuting. It's commitment to hard work. You can just, put your hands down and don't do anything. You can't. You're not going to progress, unfortunately, I'm afraid. You have to invest a lot of work in that, clinical and non-clinical, as we said earlier. And sometimes, especially during the early years, you have to play the dummy. You have to downplay your game. Most probably you'll be an experienced person who's done many years of practice before, but you signed up to be an ST3, junior doctor. You have to play it this way. You don't have to cock it up or be pedantic. Like Dr. Mahdi said, your consultant might be younger than you, just because he or she has been, especially girls, they have who are not married and haven't had any maternity leave. They might go through the system in one go, and then by the age of 32 or 33, they are consultants. And you might be older than them, and you're not a consultant yet. So sometimes you have to downplay your game and behave as a junior person. I have my own experience. When I started as an ST3 in one of the places, and the college tutor in this place was very, very supportive. So from the end, I approached the school and said, guys, look, I was doing Caesar. I was recording my progress and everything as a trainee. I have this here. If you'd like to have a look into it and see if you can give me exemption in time, I'll be grateful. They said, yeah, why not? We're going to give you an early ARCP annual assessment like everyone else. We're going to look into the paperwork and take it from there. The course tutor in this hospital decided to be my own educational supervisor in order to make this process smooth for me and look after me. So I did 6 months of neuroanesthetics in this place, and then they assessed my paperwork, and then they moved me up to a higher level of training. They gave me 1.5 years exemption in time. And what this person told me as a feedback, and he conveyed this to the higher people in the school, he was able to play it as an ST3. I didn't pretend to be a senior experienced person. By that time, actually, I've done like 8 years of or more of anesthetics in my career, which is more than a training program here in UK. But his feedback to me is, you did well, you were playing it as an ST3. So this is what you have to do. Sometimes you have to do the dummy job, and this is not easy for some people, especially if they are too senior or they've been working as consultants before and they need to pretend to be very junior in order to cruise through the system. I'm concluding my presentation. Is there hope to join training? Yes, especially after Brexit. It's a very high hope. A lot of our colleagues, overseas candidates, are getting numbers in a very short period after they come here to UK, so keep an eye on that. I think it's no-brainer. Every wise person should consider it as a means of career progress and work hard in order to get a number. The previous guys who got numbers were very, very lucky because of COVID-19. But even, you know, if the current circumstances and situations are not available, still, most probably you will get number because of the shortage everywhere. And good luck with all your endeavors. Thank you very much. Hello?
Big presentation, Dr. Mahmoud, and a great day today. I think that's extremely comprehensive. From top stars in UK, I wouldn't be dreaming to have a better day than that, to be honest with you. Dr. Adil, do you have any question in your mind, please? Do you want to ask anything on behalf of the attendees? Dr. Adil is here. Dr. Adil, are you here? I think time now, you answered everything now here. Dr. Edie, I saw you answering few questions here. And
there's one question that I've left, actually 2 questions. I think one of them has been answered online. I mean, like during the presentation, but there's the question here says, what are some of the Caesar-friendly trusts or hospitals? So my recommendation would be is that if you are planning for a Caesar, go to a tertiary center. The reason is, in a tertiary center will be all the subspecialties, especially in anesthetics. So, for example, if you are going to University Hospital and you are looking for example, neurosurgery and cardiac surgery, that you won't find in a district general hospital. And just be careful, again, some of the university hospitals don't have everything. So, for example, Manchester doesn't have neurosurgery. So if you're going and you think like, oh, I might need just a bit more experience in neurosurgery because this is where my training back in my country is like, you know, deficient, you need to see a hospital with neurosurgery. So just again, a tertiary hospital are better in terms of the Caesar in comparison to general district hospitals, but it is not impossible to do it in general district hospitals. Which hospitals trust in NHS are good for training? All hospitals who've got trainees are good for training, but it depends again on what you need. Major advantages of training posts over non-training posts. I think Mahmoud gone through that. What is the work hours of training and non-training works? Most of the hospitals, for all juniors, it is 48 hours. but that is, again, depends on your contract, but you can't exceed more than 48 hours per week, as this is a national contract. And also there's some guidance on the BMA website. So if you go on the BMA website, there have been some changes in the junior contracts recently, last year, and they actually have changed very the kind of like, there are some specific things regarding like how many hours you can work per week, even if you do extra lists, paid lists. There's a limit of that. How many hours can you do like in a row, in terms of like on calls and stuff like that. So there are very, very specific details of it. If you go to the BMA website, it is all there.
Dr. Adil, do you want to add anything?
Dr. Saad, I'm very, very thankful for you and all the panelists. It's very enriching lecture. And actually, it is money. It's not a lecture, it is a money. All this information equals money. All of us, we ask questions to get a reply to any of these questions. Thank you, all of you, for this wonderful webinar. And I want to ask one question for very, very senior, very, very junior colleagues. Is it easy for the international medical graduate to have internship in UK compared to UK resident?
Can I answer?
Yes, please.
Yeah, so Dr. Ibrahim, yeah, they will have to finish internship. So the internship here in UK is 2 years, foundation year 1 and foundation year 2. They will have to present an evidence that they have done something similar in their country. So yeah, they do to do that. They need to do that. They can just bail out of medical school and don't do any internship. They will have to.
I mean, you cannot directly come to start
join the foundation training. I'm not aware. Maybe Dr. Reedy will have an answer to that.
No, they have to do the internship. So in Egypt, for example, we've got an internship over here, which is called Al-Imtiaz, the year of Imtiaz, and you have to do that in order to be able, because that completes actually your medical education, if you may say that, like your medical degree, because without that you cannot apply for a certificate back in Egypt, at least for like a completion of a medical degree, without completing that. And the GMC, one of the requirements is to actually present this certificate for them to be able to register with them. So you can't do it without doing that here.
Yeah. Another question, please. What about our Egyptian doctor, MD? What is the easiest way to access the British system? Is it Caesar or other way, other route?
I think, Dr. Ibrahim, this has been answered during the lectures. Well, actually,
the easiest way, I mean, not the difficult way.
Say it again, sorry.
I'm asking about the easiest way, the hassle-free way. I mean, that not instead long time or procedure to continue to access the system.
I'll leave the answer to Dr. Reedy because he talked in details about that. I think he answered this question, but I'll leave it to him to answer it again.
So it depends, actually. So the MD itself, for example, MD from Egypt is not, you cannot apply for registration with the GMC with it. You can apply for Caesar. So first of all, you will have you will have to get some sort of proof of knowledge to be able to apply for the GMC. For example, the European Diploma of Anaesthesia. So you've got the MD now, and you've got the European Diploma of Anaesthesia. So in order to apply for a Caesar, there's a lot of paperwork. And in my experience, and the people I've seen, who have been through this process, it takes at least a couple of years to collect, first of all, the evidence, because you will need to collect some evidence from Egypt, for example, and you need to collect some evidence from the UK, because there will be some areas where your training is deficient, and also that they require the evidence to be within the last 5 years as well. So there might be like you've done some sort of training 10 years ago, so that will not be accepted by the GMC. So at least it takes 2 years. But if you've been collecting evidence back, for example, in your like original country or when you are working, and you've got everything, like you're collecting evidence according to what the Royal College wants. So if you go to the, if anyone goes to the Royal College website, and as Mahmoud has mentioned, in the international graduates, you go to that section, there will be more details about the CSER application and what exactly they need. So if you've been collecting these all the evidence for that, like in your country, and you give that to the GMC saying that I've collected the evidence, here it is, and I want to go directly to the CSER and be on the specialist register. And the GMC looks at your evidence, send it to the college, and the college are happy with it. Yeah. Does that happen? I've never seen it. I know about more than 10 people who've applied through CSER. Even the people who applied or been collecting evidence from outside the UK, when they came to the UK and they applied, the GMC replied back that you are deficient in that area, and they needed a bit more training in that area. So,
Dr. Edie, I think yourself and Dr. Mahmoud answered this during the lecture.
yeah.
Some people, for example, they have finished their MD, they are, for example, associate professor in one of the university in Egypt or in Saudi or whatever, and they're looking forward to have like a focus 1 or 2 years training in UK and come back. You know, I believe the MTI is the best way for them with an English test or whatever, so language test, so they can have the matching for their fellowship program or for training 1 year or 2 years, and they can finish that and they come back.
It
Is
depends
right?
again. It depends again on what you want. So if you want just an experience, yeah, you can do the EDAC or the one of the other recognized tests, and you can apply for registration with the GMC with it. However, you have to accept that even if you are a clinical fellow, if you are a specialty doctor, if you are other like trust grade, all these are junior doctors. That means they will be they will answer to a consultant. So sometimes what I find is that if someone is that senior back in their own country, and then they come to the UK with just to get some experience, and they are started to be treated as junior, and they see like the people who are kind of at their grade are kind of like younger than them and less experienced than them. They feel like, oh, what I'm doing here, I'm like, you know, I should be treated differently. But actually, the system doesn't treat you different. The system treats you based on your, you know, on your qualifications, on the contract you've signed. So there will be no privilege to treat you differently. So you have to accept that psychologically. And sometimes I find it that very, very difficult for some people. So you have to prepare yourself that when you come here, you are going to be treated as a junior doctor.
Thank you very much. Dr. Mahmoud, do you want to add anything more?
No, not
Okay.
really, Dr. Madden.
I think we came to the point to close this session now. And as I mentioned before, I am joined today by 4 people here, Dr. Mahmoud Reedy, Dr. Mahmoud Kulani, Professor Adil Ibrahim, Dr. Ahmed Abbas from Ireland. I couldn't dream that I know some better people from Mega Online course than what I have today. It's a very rich session. And I was really looking for that session for a long time, but I believe that we will need another session, how to live in UK, the system, driving license, and all this stuff. We need even to get some other people to talk to us about those people, because some other people are very interested to move to UK, but they are a little bit worried about their kids, about driving, about housing, about money, about all of this. So I think we have loads of issues to talk about. From myself, I'm so honored to have all of you today, and thank you very much. And I would like to thank my attendees today for coming here to listen to those expert and excellent people from UK and across the country. Thank you.
Thank you very much, Dr.
Welcome,
Mahdi.
Dr.
Thank you very
Mahdi.
much.
Thank you.
Would like to
Dr.
thank
Mahdi.
you really for your endless effort, Dr. Mahdi.
Absolutely.
Thank you very much.
You're almost
there.
evergreen, Dr. Mahdi.
Thank you
Look
very
after
much.
yourself
Thank
because
you.
you're doing
So
a lot.
we always say that when you have respectable people, we always extend our hands to help them. So we never say no for anybody who wants to improve himself and wants to pursue his career. And thank you very much for your help today.
You're welcome. Pleasure.
Thank you very much.
Thank you. Thank you.